Assalamu alaikum. Today topic is osteoblastoma. First of all, like and subscribe my YouTube channel. Osteoblastoma is a type of bone tumor. It attacks your healthy bone tissues and creates a new kind of tissue called osteoid. Osteoid material grows around healthy tissues. It's weaker than healthy tissues, making your bone more prone to fractures. Osteoblastoma can grow anywhere, but it's most common in your spine, hands, or legs. As the tumor grows, they may cause pain, swelling, or muscle spasms. Is osteoblastoma cancer? Osteoblastoma is almost always benign tumor, not cancerous. What? Where might I get osteoblastoma or locations of the osteoblastoma? Up to 2 in 5 osteoblastomas form around the spine. You may also get osteoblastoma in your hands, feet, legs, lower jawbone, or mandibles. What is the difference between osteoblastoma and osteoid? Osteoblastoma is another type of benign bone tumor, but osteomas don't grow, while osteoblastoma does. Osteoblastomas also tend to be larger than osteomas. Who might get osteoblastoma? Although anyone can get osteoblastoma, it's most common in people ages 10 to 30. More than twice as many males as females have osteoblastoma. हाउ कॉमन इज ऑस्टियोब्लास्टोमा और अगर हम इसकी प्रिवेलेंस की बात करें तो ऑस्टियोब्लास्टोमा इज रेयर. इट मेक्स अप ओनली अबाउट 3% ऑफ ऑल बेनाइन ट्यूमर डायग्नोसिस. नेक्स्ट इस अगर हम सिम्टम्स एंड काजेस की बात करें तो व्हाट काजेज ऑस्टियोब्लास्टोमा. एक्सपर्ट डोंट नो व्हाट काजेज ऑस्टियोब्लास्टोमा. Next are the symptoms of osteoblastoma. Osteoblastoma in your hands or feet may cause swelling or pain. The pain often worsens at night. In your spine, osteoblastoma symptoms may include following: back pain, muscle spasms, numbness, scoliosis, mean irregular curve in your spine, and weakness. Next, diagnosis and tests. To diagnose osteoblastoma, your provider asks about symptoms and examines the area where you are experiencing pain. They may also test your range of motion. Your provider also uses imaging tests to get a better look at your bones you may have. And you may diagnose osteoblastoma by X-ray to look at your bones, and CT scan, MRI, or ultrasound to provide a more detailed look of your bones and soft tissues. Healthcare providers almost always use a biopsy to diagnose osteoblastoma. In a biopsy, your provider takes a small sample of tissue from the tumor. A laboratory examines the tissue to look for signs of osteoblastoma and rule out other conditions like cancer. Next, management and treatment. Osteoblastoma treatment usually involves surgery to remove the tumor. Your provider may use marginal resection. It involves removing the part of bone that contains osteoblastoma, cartilage and bone graft, scraping out the tumor and refilling the area with the bone graft from a donor or another part of your body. Spinal fusion, relining and supporting your spine with the bone graft, and sometimes with pins or rods after removing spinal osteoblastoma. In the very rare case that osteoblastoma is cancerous, your provider may use other cancer treatments such as chemotherapy. If the tumor is very large, your provider may use radiation therapy to shrink the tumor. Next, prevention from the tumor. Because experts don't know what causes osteoblastoma, there is no way to prevent it. If your children complains of back pain, muscle spasms, or other signs of osteoblastoma, take them to the healthcare provider. Usually, a surgeon can remove the tumor to relieve symptoms. Next, prognosis. Osteoblastoma usually has a good outlook. Most people are cured after surgery to remove the tumor. In some cases, the tumor may grow again, but they are not cancer and usually don't cause severe symptoms. So it was all about osteoblastoma. Thank you.